Governors across the country are rushing to determine how President Trump's spending law will impact their own states. For instance, in Connecticut, the Congressional Budget Office estimates about 138,000 residents there could lose Medicaid coverage as a result of the legislation. Joining us now, Connecticut's Democratic Governor, Ned Lamont. Good to have you back on the show, Governor.
Governor, thank you so much for being with us. I'm so concerned, Governor. You look at the people that are going to be impacted. Now, that number, the low end is 138,000. The high end goes up to about 175,000 people in Connecticut. Families could lose health care coverage because of this bill. I'm also concerned, and I want you to tell us, like, for instance, let's say for vets who are 100% disabled, they could lose SNAP coverage. There are a lot of veterans that are saying they're not going to be able to afford groceries after serving this country honorably, having honorable discharges, and having 100% disability. I mean, to talk about what's the impact of this bill on veterans and others in Connecticut who are going to possibly lose their health coverage and also lose critical food assistance.
Hey, good morning, guys. It's incredibly cynical, this bill. You know, I thought that Trump was going to go after waste, fraud, and abuse. No, he's just shoving these things onto the backs of the states, and then as you point out, 100,000 people could lose health insurance. How does that accomplish? Today, they cut $50 million out of after-school programs for our kids in our poorest cities. Is that waste, fraud, and abuse? They're taking fresh produce off the shelves of our food share, our food bank. This is an incredibly cynical enterprise. At the same time they're doing that, they're jacking up the deficit by $3, $4, $5 trillion.
Yeah. Tell me about the impact. Let's just really drill down here and talk about who this is going to impact
and when
in your home state. Like, what health care services are going to be taken away from residents of Connecticut and every other state?
Starting almost immediately, Joe, we have tens of thousands of people who get expanded Medicaid. That's at risk right now, something we call Covered Connecticut. We're proud. We have more of our people insured than just about any state in the country. That's a good thing. I want everybody to be insured. As I mentioned, why are you going after our schools? Why are you going after daycare? We have an electronic portal. That's how you get paid. All of a sudden, you wake up one day and the portal is shut down.
Governor, we were talking about rural hospitals and the potential closure of them across the country, some in Connecticut as well. But also, let's talk about some of these urban health care centers, community health care centers in a city like Hartford. I was reading a piece just yesterday about one that says we are reimbursed almost entirely by Medicaid. We already operate on a shoestring budget. This is the place because we take care of people regardless of their ability to pay. This is the hospital in this community, and we may have to shut our doors or cut back staff and services. So what would be the impact there in terms of health care in Connecticut?
Look, Medicaid is directly impacting our urban hospitals, where a lot of our poor folks are, and our rural hospitals. You know, I tried to work with red state governors. They said, hey, come on, this Medicaid is going to hurt you even worse with your rural hospitals. But they got $50 billion for their hospitals. We in the blue states are sort of on our own. But cutting back on health care doesn't solve anything. It means people wait and get sick, then they go into the emergency room, and then we all pay for it with what they call uncompensated care, which is hospitals have to get reimbursed for the money they're spending.
So, Peter Baker, this connects to our earlier conversation, right, about how so much of the next handful of months, maybe even year and a half, is politically is going to be dictated by how both parties message this bill and its effects on voters. And we've heard some in some in the Senate have expressed concerns, even after many of them voted for it anyway. Now we have a Democratic governor saying, hey, this is how it's going to impact my state. What's your sense of how Republican governors might have to handle this? Because so many of these cuts are going to fall on the backs of their own constituents, many of whom voted for President Trump.
Yeah, I mean, that's the interesting thing, right, is that President Trump kind of scrambled the electoral calculations of old. In fact, he brought over to his side of the political equation a lot of people who now depend on Medicaid, who depend on SNAP benefits. It's a different, coalition politically than Republicans are used to. So what they're going to see in their states, the Republican governors, are people who normally might not be, have been affected in the past, are going to be affected this time. And they're going to have to figure ways to either kind of fill that need or, find a way to explain away why the decision was made this way. And that's why you didn't see a lot of Republican governors out there clamoring for this bill. I didn't see many Republican governors saying this is something that they wanted at all. I think that it reminds us that the working class people who have supported President Trump are now going to see, the consequences of some of the policies he's put in place, and he's going to have to convince them that it was right, even if they're affected.
Yeah. So let me ask you, Governor, what can you do? What can the Connecticut legislature do to provide a safety net that's been taken away from so many working and middle-class Americans?
Well, Joe, we've set aside about $4 billion. We call it a rainy day fund. It's there to protect people, usually in the case of a recession, so we don't have to raise taxes or cut education spending. My instinct is we'll use some of that. I can't use much of it. I use some of that to help the most vulnerable, especially when it comes to people getting kicked off of Medicaid, when it comes to some of our schools that need that support because it's being yanked almost overnight.
Wow. Democratic Governor of Connecticut, Ned Lamont, thank you very much for coming on the show this morning.
Thank you, Governor.
We appreciate it.